Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
According to the Centers for Disease Control, colorectal cancer is the second leading killer among cancers that affect both men and women. But it doesn't have to be that way. Proper screening can find precancerous polyps and also detect cancers early, when treatment often leads to a cure.
Yes, over 25% of adults age 50 and above have never been screened for colorectal cancer. New advances that have made the screening process easier may be one way to improve detection rates. Here to discuss colon screening is Mayo Clinic Gastroenterologist Dr. Conor Loftus. Welcome to the program, Dr. Loftus. It's nice to meet you.
Thank you very much for the invitation to speak on this important topic. I wondered whether I was really the right person to speak about this, but just yesterday in my mailbox I received a note from a grateful patient, and it was addressed to Colon Loftus, C-O-L-O-N. I said, I am the man for this, obviously, so it made a lasting impression on that patient.
It's a sign. It definitely is a sign.
So in terms of, There are a lot of myths out there with regard to colon screening and colonoscopy, and our purpose today is really to demystify some of this. And one of the things I want to speak about today is really the new methodologies for screening for colon cancer. Many patients simply fear undergoing preparation or fear having a tube entered into their rectum, and I would too if I didn't know anything about it. But work at Mayo Clinic it's been over 3 decades that our colleague in gastroenterology, Dr. David Alquist, has been evolving a technique to look for the DNA which is shed from polyps and tumors into the stool of patients who have these conditions. And this is basically microscopic amounts of the tumor or polyp which are shed, and we can pick that up very sensitively in stool. This is a test which is now available to average risk individuals, so those who don't have a family history of polyps. When it comes to age 50 and your doctor is encouraging you to do colonoscopy, if that's something that I'm simply not going to do it, you can come in and say, listen, how about that stool DNA test? It's called Cologuard. Am I eligible for that?
And is that something that patients, they can ask for that now, that we're at the stage where they can either say, let's give this a try?
Yeah, absolutely. Okay. Particularly here in Mayo Clinic. They can ask for it from their physician. They go home, they submit the stool sample, the result comes back to the physician. And one of the questions comes up is, well, is it as good as colonoscopy? And the answer, in short, is for colon cancer, it really is, and for significant large polyps. So detection of the of large polyps and cancers with Cologuard is effectively as accurate as colonoscopy for the important lesions. For small polyps, perhaps not quite as good, but you can make the argument that small polyps may not matter as much anyway. And could a small polyp become a large polyp if left over time? That comes to, what do we do if a patient has a Cologuard test and it's negative? Where that patient would have had colonoscopy perhaps and it was negative, they would go for 10 years. We do Cologuard every 3 years just to cover that possibility of a small polyp maybe being getting larger.
Wow, so that's a major advancement. I'm looking forward to the Cologuard.
Yeah, you're off the hook there, Dr. Kakar.
But Dr. Loftus, you mentioned that Cologuard may not be for everybody. Who would it not be applicable for?
Yeah, very important question. So in the current recommendations, and I say that because these may change in the future, in the current recommendations, we recommend Cologuard for an average risk individual. So that person who has not had a family history. So if your mother or father or brothers or sisters have had colon cancer or polyps, you're not a candidate for this. This is for a person who has no family history and has never had polyps themselves in the past.
Is this situation where you still have to do the prep? Because whatever I have learned, I haven't had one yet, but what I have learned is that the prep is what you worry about, that you have the anxiety over, not the actual colonoscopy itself, but the prep. Do you still have to do the prep with Cologuard?
Yeah, great question. We get a lot of questions about prep. So short answer is no. You do not have to do a preparation for Cologuard. So it's
Wow.
sounding even more enticing here.
It does.
So if you're having Cologuard, there is no preparation. And in actual fact, of course, we want to obtain those stool samples to look for the DNA in it. But an extension to that question, if I may, if you are not a candidate for Cologuard and you are undergoing colonoscopy, there are advances in the preparation within recent years that make it more palatable.
Really?
Absolutely.
All of a sudden, people's ears. And I should say, because we have 90 plus stations that carry this show, so there might be some places where people go and they don't have access to Cologuard. So let's talk about those
Right.
prep options.
So a couple of things. The first is our standard preparation that we've used for years. Patients refer to the 4 liters or the gallon of liquid that I have to ingest, and the first step was that has been for many cut from 4 liters of material ingested to 2 liters. Okay, so 50% better, but still for many it's the actual taste of the material. It's a very salty, unpalatable taste. And so for those patients now, we're oftentimes using a Miralax preparation combined with Gatorade. And Miralax is effectively a type of laxative. It's an osmotic laxative that's simply a powder that people ingest routinely for treatment of constipation. But it's a fairly tasteless powder. When mixed with Gatorade, is very well camouflaged, and patients can absolutely go to their doctors and say, okay, instead of that terribly vile 2 or 4 liters of liquid, can I, take the Miralax Gatorade preparation? Absolutely ask for that. It's a good option.
So if patients out there are listening to this and they want to see if they're applicable to Cologuard or they can get it locally, how should they find out more about it?
So the first step is simply to ask your primary care provider. If they are not knowledgeable in Cologuard, they can access the Mayo Clinic website, and there is lots of information on the Mayo Clinic website about it. And their primary care providers can order through Mayo Clinic from there.
And is that covered by insurance?
It is. It is covered by insurance. The cost, colonoscopy, unfortunately, is a fairly invasive study with sedation and anesthesia. And it, like any test like this, it gets into the thousands of dollars. Cologuard is in the hundreds of dollars range, but it is covered by insurance, and it is CMS Medicare approved at the every 3-year interval. So this is covered, and it's a great option, I would say, for those folks who particularly are not going to do anything in terms of looking for colon cancer. For those that are willing to do colonoscopy, it's probably still the standard of care, and in fact is the standard of care to still go for colonoscopy because we can deal with the lesions that we've, of course, if a Cologuard is positive, you end up having colonoscopy. If a Cologuard is negative, you can go for 3 years. So I would still say colonoscopy is the standard of care. If a person is not willing to do colonoscopy, Cologuard is a great option.
And just so we understand, if you don't have risk factors, when should you start screening and when do you stop?
Yeah.
And if you have risk factors, then what would you advise?
Yeah, good. So the vast majority of people do not have risk factors, firstly. So for those individuals, you start at 50 years of age. Mm-hmm. And if you do colonoscopy and it's negative, it's every 10 years.
For life.
For life. The end point really is quite variable, because we may see an individual in clinic who is 80 years of age and they look like $1 million. And you have to think about, well, what's the life expectancy of a particular patient? If they're going to live 10 years or even a number of years, we would continue with colonoscopy. We often do colonoscopy on certainly 80-year-olds, 85-year-olds, even more advanced than that. On the other hand, you may see a patient who is 70 and they've got significant cardiac or respiratory disease, and it may not be the best thing. So you really have to individualize the approach in each patient in terms of stopping colon screening.
We've been talking about colon screening options with gastroenterologist Dr. Conor Loftus. Thanks for joining us, Dr. Loftus.
Thank you very much.
We're going to take a short break. When we come back, kids and germs. Just how clean should a baby be?
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.